and CEO of Colgate Palmolive India Limited, experts, health professionals, leaders in the health area, and my friends from the print media and electronic media, ladies and gentlemen. It's indeed a matter of great opportunity for me and a very happy occasion when we are discussing a very critical subject, that is the oral health. When I talk about News 18 for collaborating and organizing this summit, as we all know that the Colgate India has started a movement which started in 2024, which I am told, and along with News 18 Network and the Indian Dental Association, that they have tried to create an awareness about the oral health, which is a subject which needs much attention at this point of time. So I really congratulate and thank them for coming out with this program. It is also very heartening to note, बहुत खुशी होती है कि experts or all three together have gathered here to discuss how to strategize and how to see to it that in future how we can address this, which was started by the Colgate and about making people aware about the good practices and promote oral health, and also it is also related to nutrition and very much related to tobacco cessation. So all this combined together, an effort has been made that in a holistic approach, how do we address the oral health issue that is very important. I am told that that more than 5.5 crore population has been touched, or more than 5.5 crore population have been brought into the ambit of this movement. And also I was told that 40 lakh screenings have been done. That means 4 million screenings have been done. That is very encouraging, and I thank and I congratulate Colgate and Newsware 18 for doing this, for these dedicated. Here I would also like to talk about the importance of the oral health. Although we give very little attention to the dental and the oral health, but that is one of the most important aspects. Our rishis, our sages, our saints used to say that it is the gateway of the body. यहीं से शुरुआत होती है, और इसलिए we have to give due priority to oral health, which has been neglected and which as a common man we consider it to be not very important area, but it is one of the most important area which needs to be addressed. It also helps us to address the systemic health, and for that also we know that there are many problems जो हम face करते हैं, और उन problems को solve करने में oral health is a very important factor. Nutrition is also, and for the quality of life. Here I would like to say that under the dynamic leadership of Prime Minister Narendra Modi ji, the National Oral Health Program was started in 2014. So we can say that since our government came, top priority was given to National Oral Health Mission and National Oral Health Program. And for that, we decided that oral health should be accessible, affordable, and not only accessible, affordable, but a quality health care should be given. And for that we had to develop the systems, the structures, and the training part, which was very important to make it, to implement it at the grassroots level. You will be happy to note that as far as the oral health is concerned, in 2014, this program was only in 103 districts, and now after a decade, I can say that it is now, the program is being run in 773 districts. So a long leap has been taken. And this itself means how the health program started in 2000. As far as the government of India's policymakers was concerned, we have been able to go forward. I would like to share with you that in 2014, we had only 398 dental care units. And now we have 9,183 dental care units. So you can understand how many times the structure and the infrastructure for the dental healthcare, because talking about dental healthcare does not mean anything if you do not make it realize. And when you have to realize it in reality, you should have the structure, you should have the manpower, you should have the HR. So all that was taken care, and now approximately 9,183 dental care units are being run. The National Health Mission also gave due priority to this National Oral Health Program. And when I talk about that also, 99.5% of the district hospitals were given the dental care unit by the National Health Mission, that by the National Health Program. And in the sub-district hospitals, 89.2%, the whole infrastructure was developed by NHM. And in community health centers, 72.9% of the funding part was taken care by the National Health Mission, only to make it realize as far as the structure is concerned. We have started a e-Dant Seva also, an interactive website, and also a mobile application which gives us valuable information about the hygiene and the preventive part of the strategy as far as the oral health dental is concerned. We started a Center for Dental Education and Research in All India Institute of Medical Sciences and the Center of Excellence for the National Oral Health Program. So now the All India Institute of Medical Sciences is not only Delhi, is not only a department of dental healthcare. It is a program where we have started the dental education and the research and the Center of Excellence for the National Oral Health Program. We have also developed 3 national resources. One is the oral potentially malignant disorders, which is being run in Lady Hardinge Medical College. The another is the oral health care for children and elderly, that is being run in PGI Chandigarh. And the third is the oral health for tobacco cessation, which is being taken care by the Maulana Azad Medical College and Medical Sciences. As far as the Government of India is concerned, I would like to share with you that the oral cancer, the screening or part of the oral cancer, the program for the prevention of control of NCDs, a total screening has been done for 31.98 crores. That is, the screening part has been done. And the persons diagnosed with the cancer was 1,77,000 who are being diagnosed and who are being treated through this screening. So this is all because of the infrastructure which we created, and because of the infrastructure in the past 10 years, these screenings were done, and because of these screenings, we were able to diagnose the cancer, oral cancer, and the treatment started. The patient being treated is 1,67,000. I'm just giving you the figures just to strengthen my argument that how Government of India is trying to go forward for addressing the issue of oral health. The Ayushman Bharat, we have got Indu Bhushanji here. He was the person who was the first CEO of the Ayushman Bharat and the architect who developed the world's largest health coverage program. And in that also, 22 procedures of advanced oral facial surgical interventions were included. 100 claims were made and this issue as far as the oral health cancer is concerned. The milestone was in the oral health, that was the National Referral and Research Institute for Higher Dental Studies, that is in All India Institute of Medical Sciences, Delhi. So it's not only that we are trying to see to it. Dr. Kharbanda is there. I can see him. It's not only that at this point of time we are doing pioneer institution of Government of India has taken the lead that I would like to share. Which was inaugurated in October 2024 by Honorable Prime Minister. I would also like to share with you that how policymakers make a change. You see, we had a policy of health policy was initiated and developed in 1997. That policy was a policy which took care of the curative part. It was only the cure part which was taking care. And cure part also, the tertiary healthcare was given the utmost priority. But in 2017, we came out after due consultation with all the stakeholders, having conferences, regional conferences, talking to the stakeholders, talking to experts, and then we came out with a National Health Policy of 2017, which was holistic in nature. When I talk about holistic, it was inclusive also. And when I talk about inclusive, it means it was not only the curative part, it was the preventive part, it was the rehabilitative part, it was the curative part, it was the geriatric part. All together in a holistic manner, we have tried, and that health policy in 2017 was initiated, which has brought a change. And when I talk about holistic and inclusive, we gave priority to tertiary, but at the same time we gave priority to the secondary health care, and we gave the utmost priority to the primary health care. And when I talk about primary health care, it means that now we have got 1,77,000 Ayushman Arogya Mandir, which was previously called as sub-centers. Now this Ayushman Arogya Mandir, we have a healthcare package of 12 packages of 12 areas which is being addressed at this. We have a community health officer there, and with community health we concentrate on the reproductive and the child health. We take care of the ENT part, the eyes, nose and throat. We take care of the dental part, the mental part, and the early palliative part. And mass screening is being done for hypertension, for diabetes, for cancers, and in cancer for oral cancer, cervix cancer and breast cancer. The screenings are done at the Ayushman Arogya Mandir. Now again, I will again emphasize that what is the importance of the structural change which has been brought. When I talk about 1,77,000 Ayushman Arogya Mandir, this is the first point of contact. And this is where the care starts. And we have decided that at the age of 30, we will have a screening of all citizens for dental health, for mental health, for hypertension, for diabetes, so that we are able to early detect who is going to become a patient of heart patient, or who is going to become a diabetic in coming times, and what precaution he has to take. When I say so, you will be saying कि ये तो अच्छा लगता है, शब्दों में तो बहुत अच्छा लगता है, शब्दों में नहीं, यथार्थ में भी अच्छा लगेगा आपको. When I will share with you that hypertension, 18 crore people have been screened. The same way for diabetes, 17 crore people have been screened. And more than 30 crore have been screened for oral cancer. Breast cancer is 7.5. Imagine the number itself speaks how the urban life, who are not aware about the oral health, they are being brought into the fold through these Ayushman Arogya Mandirs. इन लोगों के माध्यम से हम प्रयास कर रहे हैं कि उनको वहाँ पर इसको किया जाए. और सबसे अच्छी बात यह है कि we have started teleconsultation in these Ayushman Arogya Mandir. So when I talk about teleconsultation, you don't need a specialist. You need a community health officer who is only going to take care and who is going to screen and show the X-rays to the dental healthcare doctor, the specialist, and he is going to suggest that he is to be brought to the community health center, or he is to be brought to this district hospital, or he is to be brought to the state hospital, and that is how the care is being taken, and this I would like to share with you. A very important role this Ayushman Arogya Mandir has played in the elimination of the tuberculosis for immunization. That is also a very important part, because mother and child health is a very important part, and that is also being taken care. When I talk about the reproductive and mental health, the maternal health, I would like to share with you that the decline of the maternal mortality ratio, MMR, in India which was 130 per lakh lives, has now reduced to 93 per lakh lives, and this data I am giving of 2020-21, when Corona was at its peak. When we will get the data of 2025, it will be much more lower. The decline must be much more faster. The decline of the infant mortality rate in 2014 was 39 per 1,000 birth lives, and now it has been reduced to 27 per 1,000 live births. So, and this is data is also of 2020-21, when the corona was at its peak. 25 will speak another story altogether. The under 5 mortality, if I am talking about, the India's decline is 42%, the under 5 mortality, and the global decline is 14%. So you can understand what is the level at which India is working. The neonatal mortality of India has declined by 39%, and the global decline is only 11%. So we are much more ahead as far as the decline is concerned, and we are trying to see to it. And you see, it's a 1.4 billion country of 1.4 billion. And when we talk about, see this huge size of the people whom we are catering. I would also like to share that we have eliminated the trachoma as the public health problem in 2024, and WHO has recognized that, and we are on the verge of eliminating Kala Azar. So that is also a very important aspect. As far as tuberculosis is concerned, recently in the month of March and April, a World Health Organization report was there, and it said that India's decline of tuberculosis is 17.7%, and the global decline is 8.3%. So we are more than the double as far as the decline is concerned. And the increase in treatment is 53% in 2015, and now it is 85% in 2023. So this is how, with these figures, I only want to share that how India has taken a long leap as far as addressing the health issues are concerned, and how the data is showing that India has really addressed these issues in a big way, and we are going forward with the full momentum under the leadership of Prime Minister Modi. Medical education is also a very important area where we are going ahead. हम लोग सुनते थे when in my 70s and 80s, 1970s and 80s, when we were school and college going students, so then we used to hear ये brain drain हो रहा है, और हमारे doctors बाहर जा रहे हैं. मैं भी पूछ बैठता था कि आप बाहर क्यों जा रहे हो. So at that point of time they used to say that we do not have the necessary infrastructure where we can work. But now you will understand that in medical colleges we have gone in a big way. We had only 387 medical colleges in 2014. Now we have got 780 medical colleges in just a span of 10 years. The seats of undergraduates has increased from 51,000 to 1,18,000. And in next 5 years, we are going to have, including UG and PG, 75,000 seats. We are going to increase in next 5 years. That is how we are working. The PG seats increased from 31,000 to 74,000. So we are trying to see to it that how the PG seats, and all this I am talking because so long as you do not have the sufficient manpower, so long as you do not have the sufficient HR, human resource, so long as you do not have the technicians, we cannot really cater, it may be dental health, mental health or any other health. So that is why the increase is so immense that on which we are working. Since 1960s till the end of this century, we had only one All India Institute of Medical Sciences, New Delhi. Only one. It was in Atal Bihari Vajpayee's time that we had 6 more All India Institute of Medical Sciences. And during Prime Minister Modi's regime, now we have got 22 All India Institute of Medical Sciences. A state of the art. So now our doctors, our medical students need not to go outside. We have got the best facilities here for research, for development, for addressing the health issues. And that is how we are working. One more thing I would like to share with you is about the Ayushman Bharat. Indu Bhuchan ji is there. When I say it is the world's largest health coverage program. In 2015, I got the opportunity to, as a health minister, to chair the World Health Assembly, because at that time the chair was with India, and I, being the health minister, had been to Geneva to chair the World Health Assembly. At that point of time, the catchword or the slogan of that time was UHC, Universal Health Coverage, Universal Health Coverage. And I used to think whether India will be able to do that. Universal health coverage hum de payenge, ho paega. 5 crore people, which was the 40% of the Indian population, and now the ASHA workers, the Anganwadi workers, they have been included, and every citizen above the age of 70, of any sex and of any economic background, all are covered, and now 62 crore people are covered under Ayushman Bharat, the world's largest health coverage program, which includes 22 types of packages for dental health care also. And you will be also happy to note that the out-of-pocket expenditure, and this is not my data, this is the data which has been given by international agencies, and now the health out-of-pocket expenditure, which was 62.6% in 2014, has now reduced to 39.4%. So out-of-pocket expenditure is reduced, and the government of India has taken care about this also. This we have to understand. In Ayushman Bharat, the cancer patient, and this is not my report, this is the report of the Lancet, which says that the 90% of the people who face cancer, the treatment starts within 30 days from the day of diagnosis. Within 30 days. And these are all common people. They are all below poverty line, about whom we are talking. And this is how we are working and going forward. So I have tried to share with you about the aspects. I would like to give the commitment from the Colgate India direction. ये रास नहीं आता है. कुछ लोग हमेशा विपक्ष की भूमिका ही अदा करते रहते हैं. मैंने सारे आंकड़े आपके सामने, I put all the data. I started from 2014. I never talked before that. I only talked कि 2014 में क्या था और 2025 में क्या है. अब हम किसी की नजरें तो ठीक कर सकते हैं. एज हेल्थ मिनिस्टर भी मैं ठीक करवा सकता हूं. बट आई कांट गिव देम द आई साइट. आई कांट गिव देम द विजन. मैं दृष्टि नहीं दे सकता हूं. और मैं इतना ही जरूर कहना चाहूंगा, और क्योंकि मैं न्यूज 18 के कार्यक्रम में आया हूं तो इसको राजनीतिक रंग तो नहीं देना चाहता, लेकिन गैर जिम्मेदाराना विपक्ष प्रजातंत्र के लिए घातक होता है. ये हमको समझना चाहिए. Irresponsible opposition is very dangerous for democracies. And so we should realize and we should understand what the difference brings, what the difference comes with the change of the policy makers, what difference it makes, as far as the implementation part is concerned, and how India becomes healthier and healthier under the dynamic leadership of Prime Minister Modi. Thank you very much for giving me time.
Thank you so much, Honorable Minister, for your inspiring words. Sir, I would request you to please stay back.